The Palestine Children's Relief Fund is a registered, nonprofit, non-political humanitarian medical relief organization with over 20 years' experience in treating tens of thousands of sick and injured kids from all over the Middle East, regardless of their religion or nationality. While starting as a one-man initiative to treat one injured child in 1990, to now one of the most respected and active organizations with offices in Gaza, the West Bank, Beirut, the USA, and Europe, and volunteer chapters all over the world who support our humanitarian work on the ground. The Pcrf is the main nonprofit arranging free medical care for sick and injured children from all over the Middle East for free, placing them in top hospitals and treatment centers in North and South America, Europe, and parts of Asia and the Middle East. The foundation of the Pcrf was built on Steve Sosby's drive and determination and the faith and support of Dr. Musa and Suhaila Nasser, who were the first to respond to his appeal for help.
The Palestine Children's Relief Fund was founded in 1991, 1992, when I was going around looking for ways to establish the organization and to start bringing Palestinian children outside for free medical care. I went around to a lot of different organizations and I couldn't get anyone to sponsor our work. So I wrote a letter to the National Arab American Medical Association, and the Los Angeles chapter, Dr. Musa Nasser was the president at that time. And he had gave the letter to his wife, Suhaila, to see if she might be interested in being a part of the idea that I had to bring Palestinian kids out and get them medical care during the first Intifada.
One day we were sitting with the Arab American Medical Association meeting, and somebody brought up that an American person sent a letter asking for help to take care of Palestinian children in Gaza and the West Bank, and his name was Steve Sosby. And the organization, they actually said, well, we don't have time and all that. So Sue was sitting there. So I said, give me the information, and Sue, let us call this individual and let us get started helping in Palestine.
And she responded, and she got in touch with me, and we met, and she started to get very involved with the organization and to help get us started in the very beginning. And thanks to Dr. Musa and Suhaila Nasser, the Pcrf was able to get started and began, getting a lot of kids out and getting them treatment. And really, without their support and assistance over the years, the Pcrf would not exist. So, the idea that I had to get kids out and start supporting Palestine and supporting Palestinian children and getting them medical care really required, the support and the assistance of a lot of people. And Dr. Musa and Suhaila were the most important. And since then, we've treated tens of thousands of kids. We've done thousands of medical missions and humanitarian programs and projects here on the ground. And it's the impact that we've had increases every day, and the ability to reach out and save the lives and change the lives of thousands of children all over the Middle East is due to and thanks to so many people, and not the least of which is Dr. Musa and Suhaila Nasser.
And his sister, Christy, who took care of registering and assisting with the organization in the early years. Over 1,200 injured and sick children from Palestine, Syria, Iraq, Lebanon, and Jordan have been sent abroad for free care they cannot get in their homeland by the Pcrf since 1992. We do not discriminate on the children we help based on any political, religious, or national factors, only that we can find care for them for free. We depend on our volunteer chapters to help care for our children who travel outside for care they cannot get locally, including some who travel without their parent. The Pcrf also is the main NGO sponsoring, arranging, and running volunteer medical missions to the Middle East. Over the past 20 years, we have brought thousands of expert doctors and nurses from all over the world to provide highly complex surgery and other medical services on the ground in local hospitals in Palestine, Lebanon, Syria, Iraq, and Jordan to train local staff and to treat tens of thousands of children in need. These teams not only give their time and experience to help our kids, but are involved in improving the quality of medical care on the ground to help build up a better healthcare system for those in need. In response to the growing humanitarian crisis in places like Gaza and for Syrian refugees, the Pcrf also has a very active humanitarian relief component to the organization, which includes providing handicapped children wheelchairs, monthly child and orphan sponsorship project, summer camps for disabled youths, hearing aids, and urgent relief in war-torn places for homeless and marginalized children. In April 2013, the Pcrf opened the first and only public pediatric cancer department for sick children in Bethlehem in the West Bank, providing for the first time an opportunity for children in the West Bank to get free, expert care in a highly specialized department, which was named in honor of one of the founding members of the Pcrf and our head social worker for 17 years, Hoda El-Masri. The Hoda El-Masri Pediatric Cancer Department is the pride of our humanitarian work in Palestine, and we are in the process of building another hospital for the hundreds of children in the besieged Gaza Strip living with this terrible disease. The Pcrf also is the main organization building up a pediatric cardiac program in Gaza and the West Bank, saving the lives of thousands of children over the past decade and ensuring that Palestinian children with heart conditions can be treated in their own country without having to go abroad for care. The foundation of the Pcrf is our network of chapters and volunteers who stretch from California through the Middle East, Africa, and Europe, providing the organization the grassroots support that enables us to be independent of any political or religious pressures. We have been endorsed by such notable leaders as President Jimmy Carter and Archbishop Desmond Tutu, and have the highest 4-star rating from Charity Navigator for keeping our administrative costs low, and have a perfect score in accountability and transparency. The Pcrf depends on the goodwill and support of people all over the world to enable us to respond to the crisis facing children in the Middle East. Your support goes a long way toward helping those in need living under military occupation, in poverty, or in war zones, who are unable to get the medical care or humanitarian aid they need and deserve. Please support our continued efforts to bring love and compassion to these children in need.
What did he both have? Kevin Mara?